Hi everyone! In continuation from part 1 about blood typing, in this short concept video, I will explain what does blood type compatibility means. What blood type can be transfused with what blood type depends on the person's antigens and antibodies. Remember that when we're talking about compatibility, it means that if the wrong blood type was given, it would actually end up with what we call agglutination or abnormal blood clotting. So what is that? So let's say, again, you have A positive blood type. Remember we said that when you have A positive blood type, you have antigen A and you have surface antigen RH. But you do make antibodies against B. So anti-B. And let's say by accident, you were, for example, a patient is already hemorrhaging, they're bleeding profusely and need a blood transfusion. This patient has A positive blood type, but by accident, the incorrect blood type was given to this patient. So instead of A positive, B positive blood type was given to this patient. Now remember, B positive blood type means that they have B surface antigen as well as RH surface antigen. Now RH surface antigen is not a matter in this case. What matters is the B surface antigen. Because this person has antibodies against B, all of those antibodies that is now against B will bind to the surface antigen B on the wrong blood type. They would do something like that, clump it up, and let's say there's multiple, of course. When you do blood transfusion, you're trying to save a person by giving them lots and lots of blood. But if all of these blood are now clumped up by all the antibodies that is binding to the incorrect blood type that's been given to the person. Now you have blood that is clumping up all together. Just an example, I'll draw a few, just an example. And this results in what we call agglutination. Or in another simpler form, blood clotting. That we don't want to happen in an individual who is bleeding and need blood in an emergency situation. So if all the blood ends up clotting, you're not giving the patient new blood. And other than clotting, this can also lead to what's called hemolysis. Okay, what does hemolysis means? Remember, lysis is a good word to remember as breaking apart, lyse apart, completely breaking apart, being destroyed. Hemo, it's a good prefix to remember for blood. So hemolysis means breaking apart of blood cells. So what does it mean for red blood cells? They will blood into little, be broken apart into little shreds. No longer you have this nice circular red blood cell. They will be clumped up in addition to hemolysis. So instead of helping the patient, you actually end up killing them faster when you give them the wrong blood type. It is a very, very serious situation that you never want to be in this type of giving on them the wrong blood type. So then if we revisit the blood type chart here, I have added another row or column here with then what are the compatible blood types for these individuals. If you're A positive blood type, you can only receive from A positive blood, A negative blood, and O positive blood, and O negative blood. Why? Look at A positive, of course, you can have A positive blood type because you have all the same surface antigen. For A negative, yes, they don't have RH factor, but there's also the fact that there's no antibodies in this person that goes against RH factor. So even though they don't have RH factor, giving this A negative blood type to this individual will not be a problem because there's no antibodies against RH. If you give O positive blood type to this person, again, O positive blood type have your Rh factor as surface antigen, but there is no antibodies against Rh. Same thing, nothing happens. And O negative, also the case, not here, but also the case because it has no Rh factor, okay? So it turns out that because of the way it is, given by antigens and antibodies, our O negative individuals are what we call universal or true universal donor. Okay, true universal donor, because of the fact that when you are giving blood in a blood transfusion type of situation, you're not really giving antibodies. These are in very, very low amounts. But when you're donating blood, you're donating mainly red blood cells. So being O negative, having no surface antigen, you would not trigger this type of agglutination. You can give O negative blood to this person, or any of these blood type, because having nothing on its surface in regards to blood type means that there's no agglutination possible. Nothing for antibodies to bind to. Hence, that's why O negative is the true universal donor. Now let's continue this. What if you were A negative? What is the possible compatible blood type for blood transfusion in this case then? You can have A negative or O negative. You have to take out the O positive and A positive in this case, because this person, as an individual, makes antibody Rh. If you give any blood that has Rh factor as an antigen, this antibody is again going to do the same agglutination type of pattern that we talked about here. So this is why we have to not give this person any blood type that has Rh factor in it. And hence, that's why we're left with A negative and O negative. For B positive blood type, is similar to A positive. You can give them a B positive blood type, B negative, O positive, or O negative, because of the fact that they have antigen B, antigen Rh. This is why you can give both B and O. Again, O has no surface antigen in terms of A and B. And because this B positive individual do not make any antibody against Rh, you can give the negative blood type as well. And positive blood type and positive blood type. Okay? All right. And then moving on to B negative, just like A negative, you can only give B negative blood type, O negative. Why can't you give the positive? Same reason. You have anti-Rh. This person will make, their immune system will make antibody against Rh factor. So if you give them any of these blood type with positive for Rh factor, okay, it's going to trigger a reaction, okay? So even O positive you cannot give because it has this Rh factor that can trigger, again, this type of agglutination, and it will be a bad situation for the patient. Now for AB positive individual, they are special. Because of the fact that they make no antibodies, which means their immune system would not make any antibodies against any of the 3 types of blood antigen, because they have all of them, they are actually what we call universal, the true universal receiver. Meaning that if you are AB positive blood type, it doesn't matter if you get blood type from any of these blood type or any of these blood type, your immune system will not cause an agglutination situation. No clotting, because there's no antibodies for it. So this is why they are the universal receiver. Whatever you make as antigen, you will not make as antibodies, because you will not fight against your own cell. You will not clot your own cell. This is why AB positive individual then is the universal receiver. And what about AB negative individual? For AB negative individual, they have a negative, which means they do not have Rh factor as an antigen, and that their immune system would make antibodies against Rh factor. In this case, it changes what blood type they can get in terms of for blood transfusion and blood compatibility. They can only receive from A negative, B negative, O negative, and AB negative all the negative blood type only. Because if you accidentally give them any positive blood type, which means it does have Rh factor when you have a positive blood type, these surface antigen are going to trigger a reaction, a agglutination reaction, with the antibodies that this individual makes. So if you are AB negative blood type, you are not a universal receiver. You can only receive from negative blood type individual. If you're O positive individual, you can only receive from O positive or O negative. Why? It's because for O positive individual, they do not have a B surface antigen, and so they make antibodies against A, antibodies against B, and same agglutination clotting is going to happen for this individual if you were to give any blood type that has antigen A or antigen B. It's going to trigger a reaction with these antibodies, which is now why for O positive individual, you can only receive from O, but at least you have two options, being that you are O positive, you can have O negative blood type people as well. Now for O negative blood type individual, yes, you are universal donor, but you yourself being O negative as the blood receiver person, your immune system makes antibodies against A, B, and Rh factor surface antigen, which means if any of these other blood type was given to O negative individual, these antibodies are going to act up and attack those blood type or blood cells individuals, okay? Which is why for O negative blood type individual, even though you're a universal donor, you can only receive blood from O negative, nothing else. Because of the fact that you don't make any surface antigen, you will make antibodies against all the other three surface antigen. Only O negative blood type is safe for yourself. But you yourself, as O negative blood type, is a universal donor. We can donate this blood to any of the other blood type because you don't have any surface antigen for all those antibodies to bind. This is why O negative blood is a very, very useful blood type.